So fentanyl is a drug from a class known as opioids. Opioids are actually used every day in modern medicine for treatment of acute pain. So someone that comes into the emergency department after a car accident might receive some fentanyl for their headache or for a fractured arm or fractured leg or for belly pain. It's used on a daily basis also for sedation for individuals that might be getting a what's called a cardioversion, where their heart rate gets converted back to normal again, or for reduction of broken bones. To put it in perspective, fentanyl is approximately 100 times more toxic than morphine, and even compared to heroin, which we think as the most toxic or most lethal drug, fentanyl is actually about 15 to 20 times more toxic than heroin, so it actually makes it one of the most toxic drugs out there.
The illegal fentanyl being imported into Canada is coming from China. Once in Canada, it's being converted from a powder to a pill form through clandestine labs, which are utilizing pill presses. Well, this isn't a new issue for us. We've actually been educating our members, as well as the members of the public, through various presentations, and we have been working with our partners in 2014 as well. But I think it's important that the police and our partners show that we're trying to tackle this deadly problem in collaboration with each other. Like any street drug, trends come and go, but people need to leave with a message that any street drug is deadly.
When fentanyl overdoses present to the emergency department, what they present with a very classic group of symptoms. One is that they present with a decreased level of consciousness to the point where they're unconscious. They may have a low respiratory rate, so a normal respiratory rate is about 12 breaths per minute. These individuals present with respiratory rates between about 4 and 8. Their skin may be very cold and clammy, they may be pale, and their heart rate and blood pressure are also quite low. So a normal heart rate is about 70. These individuals might come in with heart rates in the 30s or the 40s. And that's kind of the classic presentation of a fentanyl overdose.
These are significant seizures, but we'd be naive to think that there isn't a lot other fentanyl out there, and we are working with our community partners as well as people within the community to identify the people who are trafficking, distributing, and profiting from this illegal drug.